So here we go. We'll go ahead and get started. For anybody that joined after I first said welcome, my name is Abby Patterson with Prevent Child Abuse Iowa. This is the webinar to go through renewals and the process for funding to get extended into FY24. We're here again already. But today, I'm just going to go through kind of an overview of the process, the different documents that are required to submit your renewal, a couple of one significant update related to contracts that'll apply to not everybody, but a few of you. And then we'll have time for questions if anybody has any kind of specific things that have come up. If as I'm going along, I'll try to keep an eye on the chat box, but feel free to unmute and ask a question. We will have time for questions at the end also. So with that, I'll go ahead and get started. Process in general for this year versus previous years, there have been times where we've done an amendment for everybody to extend contracts. And if you've been around for a few years, you'll maybe remember that there have been times where we've been able to do renewal amendments just by sending a letter. The biggest change this year with that process, everybody's going to get a renewal letter, regardless if you have changes or no changes to your scope of work or budget. The renewal letter is just going to cover extending your contract through the next year. And then it will also cover updates related to the DHS public health alignment into one health and human services organization. And so that's going to all be covered in the renewal letter. That's going to be very nice because if you don't have any changes, that's all we have to do. In the past, it was either or. So you'd either get a renewal letter if we were able to do renewal letters, or you would get an amendment to encompass your changes. This year, everybody's getting the letter, and that's going to cover the extension and the alignment language updates. In addition to that, if you have changes, you will also get an amendment. So you could have both, or you could just have the renewal letter. So that's a big part of the process. Regardless of which route is going to apply to you, we still, for everybody, I'll get into the documents, I guess, next. We'll go through the renewal request form first. Not that one. There we go. So the renewal request form is just capturing your information related to yes, you want to renew, or no, you don't want to renew. If you know that you don't want to renew your contract, if you can let me know that as soon as possible, that is helpful. Even if you just send me an email, I'm hoping we've got everybody wanting to renew. I do know of one that is potentially not. So with the renewal request, we've also got a portion where we talk about renewing if you want to make changes to your scope of work or your budget, or you're not making any changes at all. So that's for all of our projects. Essentially, just let us know if you want to make those changes, if you're making significant changes to your scope of work or your budget. And then we just want the name and title of whoever's requesting the renewal. And then whether you're making changes or not, we'd like to have updated information for your contract manager, address, phone, email, all of those contacts for both the contract manager and the billing manager. So I'll stop and ask if anybody has any questions on this form. Okay, I'm not seeing anything, so I will move on.
Abby, this is Barb Felstow with Helping Services. Has this renewal request form been sent out yet, or did you say it's going to be?
They've been sent out. I can resend. And I'll just, when I send out the link for this recording, I'll make sure to send all of the required documents along with it.
Thank you.
And that'll go to contract managers. If for some reason you don't get it, let me know. And let me check this out here. Is the request form different than the renewal letter? Yep. So the renewal request form is what you'll send to me. I have to have all of the information in order to work with DHS or Health and Human Services to draft the renewal letters. So the renewal request form is the paperwork you'll fill out that basically says, yep, we want to renew. Here's our contact information. And here's the changes that we are requesting if you're requesting any changes. And then the renewal letter, you will get that. It'll probably come from me, but it'll be from HHS, and that'll outline your contracts being renewed, and here's the changes about language related to the alignment. Okay. I'm gonna minimize that one. And the next form that we'll ask everybody to fill out is just an updated roster of who's on your council. So we'll ask your council name, what counties it covers, the date you're completing this. So if you completed this a month ago, if you're completing it a month from now, we just want to know the date. And then who's your primary contact? We do provide that for people on our website. So we do encourage people to use like your work email contact information. If you have hesitations about that or who to put for that, definitely reach out. We can chat through who might be the best contact person. If people have, from time to time, people will have questions about like, how do I access services in a certain community? So that is helpful that we have like a contact person to send them to versus sending them to 7 different organizations. And then whatever fields, if you have, like vacancies in your council where maybe you don't have child welfare or law enforcement represented, don't panic, just send us what you have. We know this is point in time. We know sometimes people roll off. We know sometimes people roll on. If it's a concern that you've got a lot of fields not represented, we can definitely discuss some ideas. If we have any contacts, we can certainly help try to facilitate any of those introductions or relationships. We just need to have a point in time to kind of see where everybody's at and who's involved with councils. Any questions on the council membership form? Okay, I will move on. The other 2 forms that are not necessarily required, you may be wanting to submit for changes for either your project overview or your budget. If you're not wanting any changes, you do not have to fill these out. We want to make sure we're not having you do work that is unnecessary. So if you don't have any changes, don't even worry about these. If you do have changes that you want to propose or request, any changes to the scope of work, we just want to fill out a new 3.1 project overview, and that'll cover both 2024 and 2025. So if you have home visitation, parent development, or sexual abuse prevention projects, this is the form you'd use for those. So if there's any updates or changes to what you want to do for community development activities, if you're updating any projections for those or for your core service, so the number of families or the number of children, number of visits that you propose, you'll complete, the home visiting parent development box, or you'll complete the sexual abuse prevention. If you have a sexual abuse prevention project, you can delete this box. You don't need it. If you leave it in there, it's not a big deal. And then we also want to know in section 1A or 1B, like what's your rationale for changing your outputs, or changing if you're wanting to do a curricula change, or some other significant change in your approach to completing the work. Any information you can give us about context is helpful. Let's say you got a reduction in funds from another funding source, or you got more money from another funding source, and so your project is getting smaller or bigger because of something that really doesn't have anything to do with ICAPP, but is going to impact the overall project. Let us know that, because it does help us evaluate when people are making changes. Historically, the advisory council and you know, us and HHS have looked at these and tried to be, you know, reasonable and understand things change. You know, if you're dramatically reducing the amount of work you're doing or you're proposing to do, and there doesn't seem to be kind of an explanation for it, it makes it harder to approve those. I don't have a guideline of like what can be approved or what not. We really look at those from a case-by-case basis, and we look at the big picture of the project, including the funding from, you know, ICAPP as well as other sources. You know, we know people get raises. Sometimes project models change where the recommendations for, you know, number of families on caseloads goes down. And so all of those things can contribute to that overall picture of the project. Additionally, when these contracts began, we were right at the start of the COVID pandemic, and that's kind of the general purpose for the contextual modifications. Question number 4. We didn't know at that time what the impact of COVID and social distancing and things like that would have. But if there are COVID or other contextual modification or contextual considerations that should be considered when we're looking at any changes, or we're looking at what's going on with your project, it is helpful to have that contextual information as well. Any questions on this form? Let me check the chat here. Okay. Hearing none, I will pull up the last form is the budget. This is very similar to the budget that we currently have on file. I'm not sure if I really made any substantial changes to this whatsoever. We still want to have the budget completed. If you're requesting a substantial budget change, we want for both years, so for 24 and for 25. Just having some of those details about those different spending categories, and want to make sure that the contract number is included on here, the contractor name is included here, and then that should auto-populate. And then the information on those line items and the line item detail should populate into kind of this overall budget table. And in here, you'll also be able to provide information about your other funding. So we want projections to encompass the whole program, whatever you're going to report on. So if you have, let's say Early Childhood Iowa, because that's probably the most common. If you also get Early Childhood Iowa funding and you have a PAT program, when I look in DAISY, I'm going to see all of your PAT program, and that's going to include not just what ICAPP pays for, but also what Early Childhood Iowa is paying for. We know that there's a lot of blending and braiding of funds, and so we want to be able to see the whole picture of your project when we're looking at your budget. It kind of helps us to track from a federal reporting standpoint. We know we're not the primary or sole funder for most of our projects. So that information is necessary, and we want to see all your other funding, or whatever I see in Daisy should be kind of in alignment with this. And then if you have multiple counties that have different funding amounts out of the total, we just want to see the breakdown, like how much of your funding goes for Dallas, how much goes for Polk or whatever, Cass, Audubon, whatever. And then if you have any comments, you can put it in the narrative as well. And we know sometimes we don't always know what other funders are going to do, especially when we look at what's the funding picture for 2025. Best guess, you know, we understand things change like that. We just want to see what's the best estimate that you have based on history, based on, you know, pending grant applications. If things change, we can always do an update on this too. And 24 and 25 is going to be the same. If for some reason you find a weird glitch in my spreadsheet, let me know and I'll fix it. I've tried to user test it and double check everything, but if there's anything weird or wonky going on, please let me know. I haven't heard of anything yet, knock on wood. Okay, questions on the budget changes, budget forms? And again,
I was wondering.
Oh, go ahead. Kim, I'll go to you.
I know you had said that if you get a raise or whatever, you know, we always get cost of living. So how does that, surely doesn't change the other scope of work, but it would change in the budget page, correct?
Yes. So let's say if your line items aren't changing, I wouldn't recommend that I wouldn't say you have to do a new budget. You certainly can, but if the only thing that's changing is like maybe there's additional funds going to salary, or I mean, a lot of times it does change the scope of work. If there's a smaller amount of FTEs because the FTE costs more money, sometimes that'll change the scope of work, or sometimes there's just more funding that's additional to the project, in which case that would be changed in this area when we look at other funding sources. So I guess in that case, I would encourage you to submit the new budget just so we have the other funding information. That's a good question. Okay, question in the chat. We budgeted for a decent amount for training and travel, but since COVID, many of the trainings are offered virtually. Do we need to submit a new budget to move between categories? I would say if you're really just doing a very small shift, that you would project to be covered in your 10% allowable shift, you wouldn't need to. I mean, I think if it's more than a couple percentages of your total budget, it might be a good idea. It might be a good idea just to submit that and then have it. The other thing is, you know, if it's pretty close and next year you find, yeah, we're still not going to as many trainings, or we're still not needing to budget as much for travel, we can do mid-year budget changes. The only thing I'll say on that is you have up to the 10% shift, and then you can't bill, you can't use a new budget retroactively. So sometimes people find like, hey, it's February and we need to do a budget shift. We can't retroactively apply that to January or December. We can only use it for the month we receive it and going forward. So if you need to do, I mean, if you think you're going to be close, I guess err on the side of caution that's kind of a hard question to answer. If you think that is possible, you're going to go over the 10% with your current budget. You can do it now. You can also do it later. Just be mindful to do it timely. Okay. Other questions? Out of here, I'm going to go back to my agenda, and I think we are up to additional updates. The update that I have to cover is really only going to impact short-term home visiting programs and group parent education. Starting in FY24, we will be switching from the traditional protective factor survey to the retrospective PFS2. And I'm not sure if that's been announced, if you have other funding or anything like that, but that will be impacting our contracts that currently use the protective factor survey. We're working on getting training up and scheduled. I actually think Christy Rusa with the state, I think she's with the McVie team, working with the HOPES program. Anyway, the state family support. She's getting some training scheduled on the Institute. If they're not already out, they will be soon. And we'll be getting some training rolled out for that. There will be at least a couple offered this year. The retrospective PFS is actually a little less work because you don't have to do a pre-test and a post-test. It's just a post-test. And the post-test will ask, okay, how would you compare when you started the program versus now? So the nice thing is you only have to do it once, but that is a change that you'll see in your contracts if you have a home visiting, or it's not applying to home visiting, but the contract language is the same for both. So either home visiting or parent development will reflect a change in that evaluation tool. And questions on that, I can try to answer, but a lot of that will be rolled out during the training for those as well. And I know at least several have had training in the PFS too. It's not substantially different. It's not administered substantially different other than it's a pre-post at the same time at the end, or after services have started versus getting one at the very beginning. Questions on that? Otherwise, are there additional questions? Okay, well, I'm not hearing any, but of course you can always email me. Renewal requests and documents are due, I think April 1st is the date I gave, which I think is a Saturday. So it'll be due the Monday after, which I believe is the 3rd, but I don't have my calendar in front of me. It'll be due the first business day of April. End of day is fine. If you are concerned that that's not enough time or you have questions that are unanswered, let me know. We can work through it. I do want to give a little bit of an overview on the timeline. I will be reviewing those renewal requests and kind of summarizing them. If I have questions about any scope changes or budget changes, I will follow up with whoever, the contract manager or whoever submitted the documents. I know sometimes it's not the same person. And then we will be meeting in the last half of April with the advisory committee, and they'll be making decisions. At that point, we'll talk about, if there's any projects that are, having some performance concerns, we'll talk through those in terms of decisions to renew. And then Any contracts getting renewed would get a letter or not get a letter, or get a letter stating either way by May 1st. Related to that, that's going to be the letter that says you're getting extended, and it'll have the language changes in there about the alignment. Renewal contracts, if there's amendments, are going to come out a little later in May. So those will be a little bit after May, or a little bit after May 1st. But we will have, I'll try to get those out by the first week of May, depending if I have everything that I need from everybody involved. That should not be a problem, but sometimes those things are out of my control. But if everything is timely and everything goes according to plan, that is what I would expect. And then those would be due back to me sometime around the end of May. I'll have a couple days to review anything because I typically have to get that to HHS within the first couple days of June. So contracts will go out. You'll have time for review and signature. And then once they go to HHS in early June, I should get them back once they're reviewed and signed, and ideally have them back to you via email by the end of June with everybody's signature. So that process should be closer to normal. I know we were somewhat delayed last year. I'm anticipating we don't have similar delays this year. Any questions on the timeline? Okay. I will take the silence as good deal. Everybody's on the same page. But if questions come up as you're going through things or getting ready to submit, definitely feel free to reach out. I'll do my best to get back to you as soon as possible. Next week is a little less crazy than this week. So if you submit something now and you don't hear anything for a day or two, don't panic. But other than that, that's all I have related to renewals.
Thank you, Abby.
All right, thanks. I'm not seeing any more questions. I'm going to stop recording.